And I will now go ahead and introduce our expert today. So we have Dr. Michael Morse. Thank you so much for being here and doing this with me. Dr. Morse is our child, adolescent, and adult psychiatrist at the Chesapeake Center. He's also the director of psychiatric education and training. He specializes in the treatment of ADHD and anxiety. Dr. Morse received his bachelor's degree in political science from Swarthmore College, his medical degree from Harvard Medical School, and a master's in public administration from the Harvard Kennedy School of Government. He completed his psychiatry residency at George Washington University and a fellowship in childhood and adolescent psychiatry at Children's National Health System in Washington, D.C. Dr. Morse is board certified in both child and adult psychiatry and is licensed to practice in DC, Maryland, Virginia, and Florida. So thank you, Dr. Morse. Do we want to go to the next slide so I can talk about your superpower? Perfect. So, and I'm Julianne. I'm our Director of Outreach and Communications at Chesapeake. I like to think that my superpower is connecting families to the right resources. And Dr. Morse has a wonderful superpower of bridging medical research and patients' goals and values to optimize treatment. So, without further ado, Dr. Morse, I'm going to pass it along to you and we can get started.
Thank you, Julian. All right. I appreciate the opportunity here to be here today to talk about one of the topics that most excites me, which is ADHD evaluation and treatment. It's a topic that's getting better understood over time, though there are still really big deficits in terms of thinking about women and girls and non-binary folks. And so that's a major research interest of mine is advancing that understanding. And so we'll start today with an overview of ADHD and thinking about symptoms in some different fictionalized characters and how that would impact their life. Um, there are two ways that one could think about ADHD that are commonly used and are helpful. One of them is looking at either the American Psychiatric Association's DSM, Diagnostic and Statistical Manual, which is what most doctors in the US use to make diagnoses. And then there's a similar manual put out by the World Health Organization. And in these guides, ADHD is broken down into attention problems and then problems with hyperactivity and impulsivity. And there are 9 symptoms in each of those two areas. And that will, reviewing the list and with a physician or other practitioner and seeing whether you meet criteria for those symptoms and don't meet criteria for something else, like let's say a severe sleep problem, which could cause inattention, but it wouldn't be an ADHD reason for inattention, is a pathway to getting a diagnosis. Um, there are, you could say, more modern views, though they've been around for a number of decades. They take an executive function model and think about various executive functions like organizing and planning, managing strong emotions, mobilizing effort. And ADHD is thought of in those executive function models as challenges with those executive functions. And those models don't have a list of kind of necessary and sufficient criteria where if you meet 6 out of 9 on this or 6 out of 9 on that, then you get a diagnosis. There are different ways of thinking about the challenges of the problem. It's best to be able to use both models simultaneously. And one way that the core model that's been around for even more than 30 years has been modified is to think about attention problems and then problems with hyperactivity and impulsivity, and then a third domain of emotion regulation or emotional impulsivity. Since a lot of folks with ADHD find that they have challenges regulating their emotions, kind of going 0 to 60 with emotions, or getting upset and then having trouble kind of coming back down to a calm point. And so, just a little bit more about symptoms and how they impact life. Many little kids have a lot of difficulty with motor hyperactivity, running around, running into things. Little kids with ADHD, on average, sustain a lot more injuries than kids without ADHD because of their physical movement. And as folks get older, and in general, females greater than males don't have much in the way of problems with hyperactivity, though may still have challenges with impulsivity, like interrupting conversations, getting up in meetings or at school when you're not supposed to be. But certainly the presentation that historically was missed was an inattentive presentation of ADHD, where the hyperactivity and the impulsivity are really not prominent, but rather people are having difficulty focusing, paying attention. If girls are in a situation where the expectations are not high relative to their innate capacities, they may be able to daydream for a large portion of the day and still get schoolwork done or achieve other goals, and so may be missed. And this has historically and continues to be a huge problem in terms of diagnosis. Um, and so those are a couple examples of symptoms and how they impact life. I'm going to be brief in each of these sections so that we have most of our time for questions. And please do write questions as we go so Julianne can interrupt me and this can be more interactive. The role of medications in treatment. So I think that one important way to think about ADHD treatment is to think about what is the scientific evidence base. And the scientific evidence base is that some of the most important things we do for ourselves are get enough sleep, move our bodies, have nutritious food, and be socially connected. And so, independent of any discussion of medicine, those are important things that we do for our health and really every cell in the body, not just the neurons, not just brain cells. Um, and those are also important if people are taking medicine, because if someone doesn't get nearly enough sleep or has really inadequate nutrition, or never moves their body or is quite lonely because of lack of adequate social connection, medicines don't work as well. So before even thinking about medicine, even though I am a psychiatrist and I prescribe medicine every day, I think about those core needs, social, biological needs, and I work with people to think about how one can improve upon each of those from wherever one is starting. Right? You can't force yourself to get 8 hours of sleep at night, but you can guarantee you're not going to if you're up late on a device. So there's a question of making yourself available for sleep, planning time for movement, and we can discuss this in more depth if people have questions about this. And so then medication fits into a comprehensive ADHD treatment plan by setting those things as foundations and then seeing, as is usually the case, even if those are moving along decently well, most people with ADHD still don't feel like they're achieving their goals without medication. And so then we think about medications that could be added and of additional benefit. And so a simple and useful breakdown for ADHD medications is stimulants versus non-stimulants. Stimulants are the medicines that have been around the longest, and they're still the most powerful medicines we have for ADHD. And there's only two chemical structures, methylphenidate. Uh, Brand names of medicines in the methylphenidate family include Ritalin, Focalin, and Concerta. And then there's amphetamines, and so that includes Vyvanse and Adderall. Um, Importantly, there's methylphenidate, there's amphetamines, right? Methamphetamine is neither one of these, though you could see how people could sometimes get confused. That's a drug of abuse that isn't prescribed for ADHD. Um, these medications can be powerful and can be harmful when they're misused, but the vast majority of the time when I see people, the issue is not too much medicine, but too little. And I'll talk about that a little bit more in a minute. Just to finish the breakdown, so you have stimulants and non-stimulants. And so among the non-stimulants that are highly evidence-based in kids and adults, we have a medication called atomoxetine. Its brand name is Strattera. And it's about two-thirds as effective as the stimulants on average. In kids, there's another group of medicines, and the two medicines in that group are clonidine and guanfacine. And those work very well by themselves and also in combination with stimulants, though again, they're not as effective as stimulants alone. And the medications tend to work well in adults too, maybe not to the same degree. However, the research in adults is quite limited, unfortunately. There are some other medicines that have also been shown to work, but in a relatively smaller number of clinical trials or in less well-performed clinical trials. And so going into those details right now doesn't make sense. Most of the medications increase dopamine and norepinephrine, I could say all of them, as a neurochemical that can communicate between neurons. And so they all appear to have a final common path where they all have that impact. But they have different steps in the process. And the stimulants have fewer steps. And as soon as they get absorbed in the intestine and travel in the blood to the brain, they work. And then some of these other medicines, the non-stimulants, have delays of days to a number of weeks. And so what we know from that is the story is not just absorption getting to the brain and working. There's a more complex story, and usually complex stories have to do with what happens inside of cells and inside of cell nuclei rather than just a conversation between the cells. Um, with regard to thinking about dosage range in general, for the stimulants and for the non-stimulants in adults, there can be great variation in how much medicine is helpful. And so some people can take the smallest pill on the market or even half of it and find it quite helpful. And other people, though it's not so common, really need more medicine prescribed than is FDA approved in order to get full benefit. Of course, if someone were to be pursuing medication in that way, it would need to be with careful consideration to the risks. So there's great variation in how much medicine is beneficial. And there are a number of important elements that unfortunately many prescribers aren't experienced in thinking about, which is that in particular with the stimulants, they work for a certain number of hours. And every medication has its own way of being absorbed and delivered into the body and then entering the brain and then being broken down. So some medications enter, have a high peak, and then quickly are metabolized. Other ones enter, have a more moderate peak, and are metabolized more slowly. And so you can imagine if you're someone who has side effects to medicine when it's entering your body or leaving your body, an up and down multiple times a day is going to produce more side effects than a smooth release. There are other people who want to have medicines only for certain purposes, and they may better more from the immediate release medicines that get in and out quickly. When thinking about potential benefits and side effects, big picture, when we think about the stimulants are pretty safe medicines that are unlikely to cause significant harm. They can be thought of as similar to caffeine, but more like 3, 4, 5 cups of coffee, perhaps, than just one. And so they increase heart rate and blood pressure, usually a little bit. Although it's uncommon, some people become more anxious with them. Most people would not drink 5 cups of coffee before bed, and likewise, most people would not take their stimulant medication right before falling asleep. Right? There's some other challenges that we think about with the medicine, but the most common thing when people take medicine is there aren't any big problems. In kids, we're more concerned about appetite suppression because they can suppress appetite. In most adults, a little bit of appetite suppression doesn't negatively impact health. And then in terms of benefits, unfortunately, there's an exceptionally long list of risks that people with ADHD have in higher measure than people without ADHD. And so these include all sorts of things, thinking about kids and then into adulthood, like unintentional accidents as kid and motor vehicle accidents leading to emergency room visits as adults. People with ADHD are more likely to have depression, anxiety, and other mental health challenges, more likely to get pregnant unintentionally or to get someone pregnant unintentionally, to have trouble finding a job and keeping a job. So unfortunately, it's a pretty long list. And any of the medicines, if they work for an individual, has the potential to help with any of these challenges. Usually the benefits won't be perfectly even over all these different challenges. And sometimes it can take months or even more to fine tune the medication to really have it best target the top priorities, which we sometimes call target symptoms for a patient who's taking the medicine, while also minimizing the side effects. Julianne, anything so far that I should field?
I have a question for you about
Yeah.
the treatment recommendations for those who are pregnant or breastfeeding. So, can you talk a little bit about the
Hmm.
potential side effects there? Or
Yes, I will. I will share my best understanding with an idea that anytime I say something, it should be taken as a bit of information with a grain of salt and discussed ultimately with a clinician. And so I'd say maybe 2 grains of salt here would be warranted. Um, the general idea is that it's really great for people who are pregnant to be healthy. in terms of every sort of health, including mental health. And so it usually makes sense for people to take fewer medicines in general when pregnant and also take medicine that is needed to maintain good health. And so there are some people, um, when pregnant or when breastfeeding, right, who really don't miss ADHD medicine if they stop it that much. And they would decide ultimately with consultation from their doctor, but the decision would be theirs, to forego medicine during pregnancy and breastfeeding. And there are other people for whom stopping medicine or reducing the dose would cause major problems, perhaps a substantially increased risk of severe depression or an anxiety disorder, and that ultimately would be more risky than continuing the medicine. There are questions about appetite suppression when breastfeeding, and that would really be something that would be thought about between the person who's pregnant and their clinician. And then certainly weight can be tracked. And there are different opinions about that across the provider community, I think the scientific community. I think the major principle here is that in general, historically, women's health has been, grossly inadequately researched and has not been an adequate focus. And women's health during pregnancy has not been thought of in the way that it should. And so people maintaining their health while pregnant is really important. And medications don't have to be zero risk to play an important role in doing that. The risk should just be lower than other approaches to maintaining health that don't involve medicine. And so that's the principle that makes the most sense to me. And when I'm working with folks who are pregnant, that's what guides our thinking.
Thank you.
Thank you, Julianne. Okay. So medication and what to expect. So as a general matter, with most medicines, I imagine, we start with a relatively low dose. Sometimes we start with enough medicine that we think could be helpful, and other times we start with a medication dose that is below what we think will help, just to give the body a chance to get used to it and to minimize any transition side effects. And so, depending on the medicine, the dose that's started, how risk averse a patient is, how much they really want to avoid side effects versus feeling like in a bit of a hurry to get treatment going because maybe they've waited years or decades to get the diagnosis, right? A dose may be started in a very low or at a low level and then increased. If it's a stimulant, in theory, could be increased every number of days because in a number of days you may have a chance to know what a stimulant does, but sometimes it takes a lot longer to get data. And so as soon as one feels like one has a reasonably clear sense of the medicine's benefits and any harms, then you're in a position to increase the dose typically. And so it can be the case that within a week or two, people find a dose of ADHD medicine that's really helpful. And then the far end of the spectrum, people who have a tendency towards side effects from medicine, it can take months, even with careful work, because it's important to try to avoid any moderate or severe side effects at least. And so that may require careful dosing and small changes at each visit. Um, in terms of evaluating effectiveness and thinking about tracking progress, it's best to have an idea of what we want the medicine to do as clearly as possible before the medicine is started. So some people will say to me, I get to work late frequently enough that I'm on a performance improvement plan and I could lose my job. When I'm at work, I do pretty well. I'm not that efficient, but I'm really good at my job and I'm excited by it and I do really good work, even though ADHD causes me a bit of a problem at work, but I'm actually in trouble with regard to getting to work. Right? Other people might say, getting to work's fine, but I get there. And even though I really want to focus on things right now, my job is super boring. And I just can't keep my mind on the task. And I spend 3 hours at work more than I wish to. And depending on the stage of life, I don't have time with my friends or my partner or my kids, right? And I'm still not performing well. And for those folks, getting to work on time or being specific about work performance might be pretty helpful. Other times people tell me, I have trouble organizing my things, I have trouble organizing my thinking, and I go through the day and I just don't get done what I want to, but it's really hard to be specific about where the biggest problem is. And so in that case, we might say, well, if medicine works really well, you're going to notice some changes. And over the course of the next conversations, we're going to try to get more specific about what your primary goals are for medication treatment, your target symptoms. But it's hard to be really specific on day one. We've done our best as a team. And so we're going to start the medicine and we're going to track how it's going. And as we get to know each other better, and as you have an easier time identifying more precisely what you want the medicine to do, then we'll have a better sense of what we're tracking. And so sometimes we really know in a detailed way what we're tracking, and other times it's more diffuse. Um, the best practice, in my view, in terms of working with the prescribing physician, is to have frequent follow-up even though these medicines should not be considered high risk under most circumstances. They can cause side effects and they can cause burdensome side effects that don't really produce any threat to the life of a person. And then also, very rarely, they cause very high blood pressure, some other sort of problem. And so I think it's ideal to be working with a physician partner who's available, including to some degree, at least in off hours for emergencies, and is available for urgent visits if they happen on rare occasion, and has a schedule that allows regular follow-ups, so that you don't feel like you have to manage the medicine on your own, which isn't usually ideal because medicine is usually best managed as a team between a patient and provider. And so I think that having someone who's available to meet with you regularly and as needed is a really important thing to maximize the likelihood the medicine is beneficial and to minimize the risks.
We have some wonderful questions, so I'm just going
Let's
to
do it. Yeah, yeah,
yeah,
let's do it.
let's do it. And hopefully we can get to all of these, but two points that came up are the ADHD co-occurring with other diagnoses. So, for example, ADHD and autism for girls. Does this impact the efficacy of stimulants? And then, kind of along with that, anxiety and ADHD. How often should anti-anxiety meds be taken with ADHD? It can be
Mhm.
hard to separate those symptoms. So, starting with those two questions.
Okay. That's a great place to start. Okay. So, on average, for autistic folks, medicines don't work quite as well as for non-autistic folks. Medicines can still be exceptionally helpful. So it's no immediate cause for concern, but it's just good to be aware that while medicines can be very helpful, it's also really important not to underinvest in various sorts of behavioral and psychological treatments if one is autistic or has an autistic kid or this sort of thing. Um, Girls who ought to be diagnosed with autism, when they get an ADHD diagnosis, on average, it actually delays the diagnosis of autism. So that's an important thing to know because the autism diagnosis can often be quite helpful and clarifying, helping someone to zero in on the sorts of skill building that are going to be most useful and helpful and necessary for, if it's a child, developing and moving towards independence for many people with autism in adulthood. Um, and so ADHD treatment can be super helpful, I'd say, for pretty much anyone with any co-occurring condition. There are some situations where one must be much more careful with ADHD treatment. But for autism, it generally just means treating ADHD the way another condition, autism, which would be treated, which would be thoughtful about the dosing, usually starting with a bit lower dose and going up a little bit more slowly, because side effects are somewhat more common when a person is autistic. There are some symptoms that overlap between ADHD and autism. And while historically there was an idea that once we know enough science, we'll be able to say what is the essential element of each and every diagnosis, and they're going to be discrete and entirely separate. That's not the way that the science has developed, and that's not the way our understanding has developed. So, one way to think about ADHD and autism is that they overlap in a Venn diagram sort of way. And so there are some symptoms that are common to both, and some symptoms that really should be attributed to one or the other. And ADHD medicine is likely to help with any of the symptoms that should be attributed to ADHD. So certainly difficulty sustaining attention would be a core one. Challenges with motor hyperactivity or with impulsivity, including interrupting, challenges with emotion regulation. ADHD medicine could be helpful with all of those in someone who's autistic. And also, if someone's autistic and autism is getting in their way some, then you wouldn't expect that ADHD treatment alone would take you quite as far as if ADHD were the only challenge being faced, because you have two different challenges that may together be additively or in some other sort of interactive way be producing symptoms. And so it would just be important, as it always is when there are multiple conditions in play, to not ignore any of them, though you may prioritize treating one first and the other one second. Um, with regard to anxiety, there's a common misunderstanding that stimulants usually worsen anxiety, and the research does not support this idea. It's actually the reverse. Um, it is frequently anxiety provoking to have untreated ADHD because bright people can know that they are capable of doing things and sometimes get very unkind feedback from others in their life. You could be doing better, you have more potential, this sort of thing. Or you did something once, why can't you always do it reliably and consistently? And so an ADHD person may know that they're not as consistent for themselves as they want to be, not as consistent for others, and that can be super anxiety provoking. And so ADHD treatment usually reduces that form of anxiety. And in ADHD folks that I work with, that's a very common form of anxiety. So it's important to know that although it's possible for ADHD medicine to increase anxiety, usually we see the opposite effect. Um, when it comes to ADHD and anxiety and which is the bigger problem or which to treat first, that's actually the most common clinical dilemma that I face in terms of the patients that I see. I'd say the large minority, if not the majority of people I work with have ADHD and anxiety, and sometimes there are other things in play too. So sometimes it's pretty easy because one is clearly a bigger challenge than the other. And then a lot of times people are stressed about not performing. And you say, okay, well, maybe ADHD medicine will help with the performance and reduce the distress. And that's true. But then they also spend a lot of time stuck in anxious thoughts. And that's a form of distraction. But it's not an ADHD form of distraction, it's an anxiety form of distraction. And so I appreciate that question was raised. And there aren't blanket answers. A person seeking treatment may have a good sense this problem is really bigger than that. And then, of course, they ought to communicate that to their provider because that would be an important conversation to have. And other times, it's really hard not only for the patient, but also for the doctor. And you do your best to figure out which is the biggest problem. And my approach involves using a lot of psychometric, standardized rating scales, and other sorts of approaches to really try to answer this question the best that we can in the first visit. And sometimes it's really hard to know. And I feel like I'm right on the fence. And if I feel like I'm in that position, then I will say to the person I'm working with, the patient, what's your gut say? Because sometimes the data is just not there to determine which way to go. We try to figure it out together, knowing that this is a human process. There's a lot of science behind it, but sometimes things are ambiguous. And proceed carefully and see whether whatever treatment we chose is helpful. And if it's not working out, then sometimes we come back to that question that we didn't have fully answered in the first place and take the other fork in the road.
Another question about ADHD stimulant medication and hair loss, alopecia.
Um, that is not a common problem. Um, I've treated a number of thousand people, and I think a couple of times people have mentioned to me that perhaps that's an issue. And I would bet that if you look at all the reviews out there, you would see it sometimes as a 1 in 1,000 and sometimes as more common than 1 in 1,000, depending on the review. I think that it's tough when there are quite rare side effects to get clear numbers on what is the frequency. And so if someone starts medicine and anything happens immediately afterwards or shortly afterwards, and there's not a better explanation, it's good to imagine the medicine might be causing it. But obviously, if you start the medicine, your appetite is suppressed, you're almost certain it's the medicine because this is a known and frequent side effect, even if it's mild. And if you start the medicine, and you only have left knee pain, it's kind of hard to imagine the mechanism there, though still maybe the medicine contributed to some sort of circulation issue. So I think it's important to be aware in terms of the broader principle that medication um, like stimulants or non-stimulants has only a handful of somewhat common problems. The common problems don't tend to be a huge deal typically, though in kids they're more likely to be because the appetite suppression is more likely to be a big problem in kids. And then there are these rare side effects. And although I made this mistake once when I was in training, I said that can't possibly be a side effect of the medicine because it wasn't supposed to be, and I'd never heard of it, and it wasn't it wasn't in any of the articles I read. It turned out to be the medicine was stopped, the side effect went away, the medicine was started, the side effect came back, and I've never said that again. Rare side effects happen, but they only happen rarely. So I think it's important to be aware that it's possible and to be in conversation with a provider about that.
Okay, great. And then I know we have a few more things to get through, but these are just great questions. So can you talk a little bit about
Yeah.
when your dose wears off for the day, and you get like a rebound dip in energy because sometimes people talk about feeling like they like hit a wall or just like completely depleted.
Yeah.
Um,
Yeah. I've got an idea, Joanne. Why don't I do this last slide and then I can like not be like
yes,
a person in a box and I can have my background and then
yes,
you'll remind me of that question, okay?
perfect.
So because I appreciate that very much. So um to quickly touch on common concerns and misconceptions, there are also maybe questions on this. So, there is a bias called the naturalness bias or the natural is better bias, which is a bias that we all hold at certain times and places that we're better off if we like don't intervene or we keep things natural. And that can often factor in to decisions about pursuing medicine. The sense is that a medicine is risky, but something being natural isn't riskier, isn't as risky. And like all things considered, it's better to put fewer things produced by humans into your body in a certain way. I mean, there's something to that intuition, but at the same time, it usually misses the fact that unfortunately, people with ADHD have a lot of elevated risks in a lot of different domains I mentioned earlier. Lots of different general health related risks, mental health related risks, accidents, and other sorts of challenges. And so leaving ADHD untreated isn't a risk-free option. And so you're not comparing a risk-free option with a risky option. You're comparing the risks of untreated ADHD with the risks of medicine. And it's almost always the case in my clinical experience that the risks of medicine, what you predict to be the case, at least before you tried medicine, are lower than the risks of not treating ADHD. There are people who have side effects to every medicine that's evidence-based. It's very rare. I've only treated a couple people in my time as a clinician for whom that's the case, but it happens. And then obviously for them, medicine's the wrong choice. But on the outset, we should imagine what are the risks of not treating the ADHD, what are the risks of treating the ADHD, and likewise, what are the benefits of not treating and the benefits of treating. And that is the balance that we need to strike. It's not only zeroing on the risks of intervention. I'm going to save stigma for now because I think some of the other questions may get at it. With regard to the potential for abuse, I'll touch on that briefly. There's some potential for abuse, and if any of us took a month's worth of a stimulant, it could be life-threatening. So it's not that the medication has zero risk. Of course, that is also true for most medicines that you can get over the counter at CVS. Most of the things, I mean, I haven't actually fact checked this, so you'd have to fact check it for me. But a lot of the things that you can buy over the counter at CVS aren't safe if taken in large doses. So that doesn't immediately distinguish a stimulant from other things that you can buy, which would be over the counter. Um, there are some concerns out there for abuse and some other health related concerns. What I would say is that if someone doesn't have a history of challenges with substance use disorders and there aren't other risk factors there, it's usually the case that treating ADHD actually would minimize the risk of not only substance use disorders or abuse, but also a bunch of other problems because treating ADHD tends to help people to have happier and smoother lives, and that promotes health broadly. So I think that is the last slide. So now we can break out and have a conversation.
Yes, and one quick point because there was a question about medication and growth, and so can
Oh,
you?
yes. Thank you. So I'll hit on that. Yeah. So this is mostly a pediatric question. Stimulants can suppress growth. And so kids can gain less weight or even lose weight, and height gain can be slower. Research is not entirely clear on what that means over the long run. It could be the case that people, and particularly people who are going to be especially tall, end up not as tall as they would be. It could be shorter by like a quarter of an inch or half an inch or possibly an inch. The research just isn't definitive. Um, most people, as long as they manage a way to maintain nutrition over time, they're going to grow just fine. There could be these slight differences. Um, and so that's a thing to think about numerically if you want to be a professional athlete, or statistically, I think if you want to be president. But it's not a huge thing, that predicts massive life outcomes. And so if it's the case that someone would be a quarter inch shorter, you could call that a harm. A risk would be the potential for a harm, and a harm is like a bad thing actually happening. You could call that a harm if you wanted to, but you'd have to balance that, in my view, relatively unimportant harm versus all the benefits of taking medicine. Um, and the non-stimulants don't tend to have that same problem associated with them. And as I mentioned earlier, they tend to be somewhat less effective on average. So when we find ourselves in a position that the most powerful medicines are also the lower side effect medicines, being a doctor is pretty easy. The challenge is when you want really effective treatment, and those more effective treatments come with a greater likelihood or number of side effects. And that's when, for me, partnering with the patient, understanding goals and values, and where we are at present becomes really important.
Thank you. And we've just gotten a lot of questions about titrating. Like I mentioned earlier, the question about the wear down at the end of the day. Um,
Yeah.
how do you address that? Can you take two different types of medication? All somewhat related questions, I think.
Yeah. Yeah. So, my experience is that this is where one of the places where specialists sometimes have something to offer relative to very skillful general practitioners. Um, on the one hand, the stimulant chemical structures have been out for like 80 to 90 years. So the most powerful medicines we have are medicines that have been out forever and for which there are dozens, really hundreds of studies. So you'd think there wouldn't be anything new, but what's new is that there is a profit motive, and pharmaceutical companies keep coming out with new releases. And the releases actually make the medicine better because you need the medicine in the brain at the right time to be helpful and not in the brain at the right time to not be harmful. That is to say, if you had a medicine where all of it was released in the hours before bedtime, it would just keep you awake, but it wouldn't be that helpful during the day, and cause all sorts of problems. Likewise, humans aren't good at taking medicine more than once a day. And on average, ADHD folks have more difficulty than non-ADHD humans. So if you just look at adherence generally in the population, as you go from once to 2 to 3 times a day, people have great difficulty taking medicines regularly at the same time 3 times a day. And so the older medicines, like Ritalin, which is immediate release, or Adderall, which is immediate release, require not only taking medicines multiple times a day, but for fine tuning, they probably require taking different doses at different times of the day. And whether you're a kid in school or an adult who's working or a retired adult who might have different schedules and different points during the day, but it's not exactly regular, right? It's really hard to take those medications in a reliable way. And so the new medications are the same chemical structures with different delivery systems. And it can be really helpful to get on one of the medicines that's been put out in the past 30 years. And some of the medicines that have come out in the past 5 or 10 are on average even better than the ones that came out 20 or 30 years ago in terms of their release properties. And in my experience, um, rebound basically disappears as a problem if the right medicine or combination of medicines, I'm talking here about stimulants, is chosen and administered at the right time of day. And that requires an understanding of pharmacokinetics, which is can be mapped in terms of a graph, which shows that as time passes on the x-axis, how much drug there is in the body on the y-axis. And you get all these different sorts of curves. And so a skillful clinician needs to think about taking one or more than one medicine at a time, how those curves overlap with all of the things you want the medicine for during the day and when you want the medicine to be the most effective, and then things you don't want the medicine to be there for. And so for kids in particular, you'd want the medicine to help with school, but not to mess with eating. So finding the most skillful way to do that can actually be a not simple and not short process, I would say.
Thank you for that. Do you ever find it that someone is on a medication for a long time and then it just stops working in the same way?
Um, I think it happens, but it's really hard to say how often it happens. And my clinical sense from working with a couple thousand people is that it's pretty uncommon for medicine to stop working. Um, However, a person's symptoms that we have called ADHD symptoms gets worse somewhat frequently while they're on the same medicine. You say, how does that make sense? So you could say the medicine stops working if the ADHD symptoms get worse. But since depression, as one of its nine core symptoms, has concentration as an issue, generalized anxiety is one of its um, six core symptoms, seven in some counts, has concentration as an issue, right? And if you look at many mental health diagnoses, you see concentration as something that emerges. It emerges when you have a baby and you can't sleep. It emerges when you're, having difficulty with life transitions, you can't sleep, when hormones are messing up your sleep, right? Anytime you have a sleep issue, you have a concentration issue if the sleep issue is significant. And so I think that it's not the clearest thing to say the medicine has stopped working when the medicine was working for ADHD, and it may be that your ADHD hasn't changed. You can say, I have greater attention and focus and concentration problems and interrupting more, but that's because you're not getting good sleep or because have a depressive episode or because you're very anxious. And so then changing the dose of medicine for ADHD is not particularly likely to help you achieve your goals. What has to be identified is which of the dozens of things that also affects attention has changed and how to address that. Um, in my experience, when that's figured out, the vast majority of the time, the ADHD medication dose doesn't need to be changed. So if you have a dose that's working and then you feel like the medicine stopped working, I would actually take a step back because saying that identifies that the medicine effectiveness is the problem. And it's usually that life is tricky, busy, has lots of components, and there's something else in life or something else with regard to health that needs to be addressed.
I'm just scrolling through all of these questions. Thank you guys so much. And I'm trying to get through all of these. And if we don't, hopefully we can put our heads together and send you some resources, which we will in addition to all of this information. What are your thoughts on other supplements? So NAC, omegas, L-methylfolate, are they safe and effective? Do you recommend them in addition to medication? And then your thoughts on melatonin for children who are having difficulty settling down at night.
Yeah. These questions are harder to answer because a lot of my answers are based on um, me being pretty skillful in reading scientific trials and retaining what's in them. And so I can usually say how confident I am about something based on the number of trials and the quality of the trial. And we don't have that sort of research for most natural omega-3 sorts of interventions. Um, so to be clear, that it doesn't mean that they don't work, right? It just means that we have less research supporting that they do work and the risks. I will say I think that there's a lot of research that omega-3 fatty acids could be good for a number of things. There's also at least one study that they increase the risk of prostate cancer, and I don't know the literature on omegas and cancer well. But there's also literature on multivitamins increasing the risk of cancer. And so when it comes to these sorts of interventions, you think, well, a vitamin couldn't be harmful, or omega-3 acids, which we know are good for like fetal brain development and this and that and the other, can't be harmful. But the reality is things that nourish cells might feed the wrong cells in the body. And so I take those questions as serious questions that actually require serious investigation and answers. I think if you were only talking about the benefits and you said if you gave 1,000 people, and it's not even clear what this is, but the right amount of omega fatty acids and the right distribution, right, 1,000 people with ADHD, would on average ADHD improve in that population? I think so. I think it would improve a little bit. I don't think it would be that impactful, but I think it would be helpful. Do we know which people are that would respond? No, but that's kind of also true to some degree for our medicine. So that's not a vote against omega-3 fatty acids. Um, what gives me pause is we do know that any of the medicines that I've talked about have some risks. None of them are risk-free. I think it's less clear with some of these other interventions what the risks are. And so, as someone who's thinking about how medicine can be beneficial, but also minimizing the harm, that gives me some pause. Julian, was there a second part to that?
I think that you answered that pretty well.
Okay.
So
Okay.
again, we have about 12 minutes. So I think we're doing good. What would you say to someone who's working with their pediatrician for medication, and when should they seek a second opinion?
Oh, well, uh, it's a broad question. I'll answer in two ways. One of them is I'm really glad there are people that are skillful in knowing lots of different things in lots of different domains of life, because that's not me. I'm like super subspecialized in ADHD, and people show up with other problems, and I'm usually helpful at helping them with those other problems. So I'm in awe of any primary care doctor that's supposed to know about like the entire body. Um, it would seem impossible to me that most pediatricians would know about as much about ADHD as an ADHD specialist. And so what I would say is if anybody has a program that is working for them, if you get a little depressed and you start working out 5 days a week and you're not depressed anymore, you don't need to see a primary care doctor. You know what to do, right? I mean, you're better. And if you see a pediatrician and the ADHD problems are addressed, there's nothing else to be done. I think when there are lingering questions, pediatricians have different skill sets, but pediatricians have to know a lot of different things. And so when there are lingering questions and they seem important, then I think that seeing a specialist could be added, more beneficial. Sometimes it's a ton more beneficial, and sometimes it's less so. And so I think the best guide is you've done whatever it is you're currently doing. I really think this is true for every stage of intervention, including before people see doctors. They sometimes like take Tylenol for the knee for 2 days or 2 weeks or 2 months, depending on the person. And it's sensible to not see a doctor every time there's any sort of problem. But I think that you increase how specialized the advice you want to be based on whether or not the approach is currently working well. And a thing with ADHD that's tricky and would be hard to get to know without a specialist is usually treatment for ADHD doesn't cause the ADHD to disappear. In my experience, things can get on average about two-thirds better. And so someone says, I think things are two-thirds or three-quarters or 90% better without medicine, just running 5 miles a day or with a pediatrician or whatever it is. I'm not sure what more is to be gained by seeing a specialist. And if people say that ADHD is better, but it's still getting in the way, and life is harder, whether it's a parent about a child, someone about themselves, someone about their spouse, right? Then I think that there's probably value in seeking a specialist evaluation.
Thank you again. Can you talk about ADHD medication and twice exceptional kids? The question is, how does ADHD medication affect twice exceptional, gifted, and ADHD?
Uh, I think that twice exceptional kids are sometimes at greater risk of secondary mental health burden, which is to say depression and anxiety when they have ADHD, because they're able to create an expectation in others that they should be able to do exceptional things, given that they're always exceptional. The math skills, reading, whatever it is, subspecialized interest in history. But then ADHD means that you're not as consistent and reliable and on point as you would be otherwise. And so you may get even more negative feedback from parents or teachers or others. They're underperforming relative to your potential. And that's painful feedback to get, whether you're a kid or an adult. And so twice exceptional kids are more likely, in my view and my experience, I think there's some research to support this, but I'm speaking mostly from my clinical experience, to get that sort of negative feedback because they raise expectations and then they can't meet the expectations. Because with ADHD, it's hard to be as consistent. And so it may be harder for a primary care doctor than a specialist to really optimize treatment for them because you have this even bigger gap between what they might do if ADHD were well treated and where they currently are. And that gap can be more painful.
What is your advice to a parent trying to decide if and when they should start medication?
Um, so it doesn't make sense to start medication if all of the problems are small. Um, of course, for that advice to be particularly helpful, I would need to define small further, and that's kind of hard to do. But the general idea is that for small problems, we don't start medicine. We try to sleep more, better, to move our body, to meditate, to, go to psychotherapy, because medication has some risks. And so there might be an approach that has fewer risks that you could pursue, at least that you start with, if the problem is small. Um, and so to me, a small problem is like a teacher says the kid zones out a little bit, but kid is learning well, doesn't have problems with peers, doesn't have big problems at home, but needs like an extra reminder here or there. That doesn't sound like a kid for whom medicine would be warranted. I think the tricky thing here is that usually kids have been struggling for a number of years before they make it to me, and sometimes the struggle is invisible, and the risk is greater in females and non-binary folks than it is in males, but a lot of males have been struggling for years too. Because if you are conscientious, you can work exceptionally hard to try to meet expectations, even if you're always falling short. And the teachers think things are kind of okay, but there's something just amiss because they think you could be doing more than you're doing. And your parents are like a little bit frustrated with you frequently and only really frustrated on occasion, but you're still getting a lot of negative feedback from them. And the parents are like, aren't all kids like this? And, a lot of kids are like this to some degree, but the ADHD may be causing a problem. And so it's, I'm sure, clear that it's hard to give a really detailed answer to that broad question. But the fork in the road to me is if there is clarity as a parent that you have like a decent sense of what ADHD is. You don't have to be like an expert, but you have a decent sense of that and decent sense of what anxiety and depression are and these sorts of things. And you're working to educate yourself about mental health. And just nothing stands out as more than a small problem, then at least initially, I don't think you intervene medically at all. You don't even see a pediatrician about that, right? The small problem continues, and maybe you go to the pediatrician, right? It continues, and you seek a therapist and a psychiatrist and this sort of thing. So that's how I think about it. I think if you're not sure how big a problem is, the most robust way to approach it is to see a mental health specialist, because the mental health specialist is going to be a better position than a primary care doctor to say with confidence, this really doesn't seem to be a problem justifying medicine at the moment. Here are the warning signs or when to come back. I would suggest that you focus on these lifestyle interventions and you focus on, right, these two efforts to get your child or yourself more socially connected, right? And then if like things are worse, not better in 3 months or 6 months, come back and see me. And so that's really the most robust way to proceed. But if the problems are really teeny, it's not worth doing that.
Okay, I think this will be our last question. And I just want to let everyone know again, I'm going to save this chat. I'm going to review it and we'll send any resources that are helpful along with this recording. But there is some information on the literature that ADHD medication can permanently change the brain. Is this true? Is this something of concern?
Um, I appreciate the question. Also, it's kind of impossible to answer in that form, in the sense that we think that everything changes the brain, right? I mean, I've got dyslexia. I still have trouble spelling. But I've worked hard to learn to read a lot of words, and I can read most of them. And every time I worked at it, even if I didn't learn the word, it changed my brain. So, I mean, I think the question is like, does it cause harmful changes that persist, right? And here's my answer. We know, although someone shouldn't be worried if they have a depressive episode or anxiety or something, we know that mental health distress isn't good for the brain. And just general distress isn't great for the brain or the rest of the body. There are different ways of saying this, but you can talk about telomeres in the cells and they shorten and their cellular aging. You can talk about stress responses with cortisol or hormones the body produces. There's a lot of different ways to talk about stress, but just persistent stress isn't great for the body. Occasional stress, sprinting or something, tends to be good for the body, but persistent stress isn't. And so when you say, does ADHD medicine cause problems? I can tell you that we don't have any definitive research that taking ADHD medicine makes your brain worse off. I can also tell you that we don't have any definitive research that taking ADHD medication makes your brain better off. The research just isn't there. But I'm highly confident that people that take ADHD medicine and that lead lives that are fuller and happier their brains are better off, as are every other cell in their body, because being anxious, depressed, feeling bad about not performing well or consistently, this is a stressful state to be in. And I'm sure of this because I've had multiple thousand patients teach me this. And so the best way I think about risks of medicine are to be aware that there might be some risks that we haven't identified yet, but to think we've had these medicines for 80 or 90 years, and we do have populations in Scandinavian countries where they keep track of everybody that's taking the medicine over decades. And so if there were big risks from the medicine, we would know it from those countries and the way they keep track of their populations. And if they're really tiny risks, we might not. But if they're really tiny, they're smaller than the risk of not treating ADHD.
Okay, thank you so much, Dr. Morris. I hope everyone can join me in just our appreciation for you just scratching the surface on this topic, but it was super informative. And I know that you have a hard stop at one. So, again, thank you all for coming. Stay tuned for future Ask the Expert series through the Chesapeake Center. If you have suggestions, please feel free to reach out. We are happy to share the information and we're glad to do this. So, thank you all so much again. And I hope you have a great day. Thank you, Dr. Morris.
Thank you, Joanne. I appreciate your partnership. Thanks, y'all.